Okay, everybody, thank you for coming to this Aging with Grace presentation. This presentation will be on balance and the science of balance. It is focused on giving you guys opportunities to learn how to understand how to create kind of a home program for yourselves to work on, and then build on that as you go along. So the idea here is, that the old saying of teaching a man to fish versus fishing for them. So I'm trying to give you guys an idea of how to understand exercise a little bit more, and kind of the different types and how they would benefit you, and what you should be doing throughout your daily life. The whole goal of all this series is to give everybody some opportunities to just live better, to give them opportunities to experience more throughout their life by being able to do more activities. And one of the main activities that is really focused on as we get older is walking. Walking is one part of this kind of exercise pyramid that I'm going to talk about, but it's only a part of that part too. So another title for this is that 10,000 steps just isn't enough, because everybody talks about taking 10,000 steps as being what you should do every day, which is a good start. It really is a good start, but it really isn't enough to achieve a lot of the things that our bodies are designed to achieve, and help us minimize our deterioration as we get older. So the first thing to talk about is, like, what is the point of exercise? Like, why do we exercise in the first place? And it's one of those questions that, when you actually think about it and get asked that question, you realize that it's not as simple as you thought. Like, what is the point of exercise? Like, why do we do it? I guess I've always just known that exercise is good for me, but I didn't know that exercise, like why it was good for me or exactly what it was doing. It made me healthier, yes, but in what way? Like, what's the mechanism behind becoming healthier? And the mechanism really is breaking down old tissue to rebuild new, healthier tissues. And we do that all the time in physical therapy. That's one of the biggest things that we do in physical therapy specifically, is we help people rehabilitate through exercise by breaking down their old pathological tissues and helping them rebuild newer, healthy tissues. And that process is something that our body does constantly turning over tissue. And it does it in response to stress. And so if we don't give our body any stress, then it never really turns over those old tissues. So then we end up operating on older tissues that have more pathology. And so that's why we respond well to exercise. That's why our bodies crave exercise a lot of times. Now, there are certain situations where our bodies don't want to exercise. And actually, unfortunately, our bodies either get used to exercising, get used to not exercising. So we can certainly, if we get into a trend of not exercising, our body will no longer push us to do that, which will result in this negative feedback loop of us doing less and doing less and doing less. And actually, even in people that are obese, the reward for exercising, our body works on a reward system of giving us, like the opiates that are released within our body. We have naturally occurring like opiate drugs that occur in our body, and cannabinoids as well, that are kind of like a marijuana type drug, right? And those are naturally occurring in our bodies, and they get released in response to things that we do to reward our body for doing them. So one thing that they get released for is exercise. Another thing that they get released for is eating. And so sometimes when we become obese, the sensitivity of those receptors that receive those rewards is decreased, or there aren't as many. It just depends. But you don't get rewarded as much. So if you're not exercising very much and you become obese, you're not rewarded as much. The other thing is, if eating is a lot easier than exercising, so people will be more likely to eat, and then they don't get rewarded as much to eat, so they eat more, and they don't get rewarded as much, so they eat more. So it's this negative feedback loop with obesity and a lack of exercise and things like that. But remember, it's all designed our whole body is designed to give us a reward for exercising. So it's a good thing. It is a good thing. The key is finding a form of exercise that you're passionate about, one that you enjoy doing, one that you will connect to. Otherwise, you're never going to do it. So plenty of times I always get asked, and I'm sure Sam does too, like, what's the best type of exercise? I think someone needs to mute. I don't know what happened. What's the best type of exercise? And it really is whatever speaks to you. Like, I will give you some recommendations and some pointers, and maybe, the idea of this presentation is to give you a bit of a framework to build that around, to make sure you're kind of pulling a little bit from the aerobic training, a little bit from the anaerobic training, and a little bit from the neuromuscular training to create a well-rounded exercise program. But if that is, if it's yoga for you, then yoga is great. You've got to just make sure that if you're only doing yoga, you're getting some level of cardiovascular fitness along with some strengthening too. Or maybe dance is great for you. Dancing is actually good across the board. It can create a good challenge to your cardiovascular system. It can create a good challenge to your neuromuscular system, like how your body controls your joints and arms and legs. It might not be quite as much strength training. So maybe you need to find a way to build some strength training into your program there. But this is the key to one of the key things to take away. One, exercise is good, if you didn't already know that. And two, the type of exercise doesn't matter as much as long as it's something that really speaks to you. So if we look at this pyramid that I was talking about, and I kind of just made this up, it made sense to me. Hopefully it makes sense to you a little bit, at least. There are kind of three major types that we're looking at here. We have aerobic exercise, which if we look down at number 1 down here, I'll highlight it there. So this is cardiovascular training, which is basically cardio means heart, vascular means your vascular system, like all the veins that go through your body. So it's working on that, also working on your lungs and heart health here. Those are the primary benefits of doing this. And in this case, you're pretty much using oxygen as to create power, to make this activity happen. You're using oxygen, which means aerobic means oxygen. So you're using oxygen as your powerhouse. This type of training, like walking falls into this, cycling, running, anything that like really gets you breathing a little bit harder. And there's different levels of this and different benefits to each level. When we're talking about when we talk about like those traditional parameters for exercise of like 150 minutes a week of exercise or 10,000 steps a day, that 150 minutes a week is based on a moderate level of intensity with your exercise. So that means that something that you're still able to like talk through a little bit, but it's getting a little bit harder. So it's not something just like a leisurely walk through the mall. When we're talking about moderate level of difficulty, you could still get it from walking, but you probably would need to be pushing yourself a little bit more than comfortable. Now, of course, that's different for everybody, but one way to help you understand that is this scale here called your rating of perceived exertion, which can be used for any one of these three types of exercise, but it's easiest to talk about it initially with respect to the cardiovascular training or the aerobic exercise. So you can see here, there are two different rating of perceived exertion scales. The one that makes most sense to me is this one that's out of 10. So 1 is very light activity. Let me zoom in on this, maybe. Hold on a minute. Thought it was going to be easier to zoom in. Let's just do it this way. Just mess everything up. Okay, so as you can see, number 1 there, the blue is hardly any exertion, but more than sleeping or watching TV. So 0 would be considered like sleeping or sitting and watching TV. 1 is a very light activity. 2, this is an activity maintained for hours and breathe easily and carry on a conversation. 4 to 6 is getting to that moderate level. So that's where we're talking about 150 minutes of a moderate intensity exercise per week, and that's to benefit your cardiovascular system. So for good cardiovascular fitness, to keep your heart and your lungs healthy, we need to be getting that 150 minutes. That is at this 4 to 6 range of moderate activity. So you're breathing heavily. You can still hold short conversations, but and it's something you can maintain for maybe an hour or so. But that's kind of about it. Now, again, I made sure I was specific about your cardiovascular system here with this 150-minute parameter, because it is going to benefit. It will benefit the muscles and it will benefit the bones a little bit, but it's really focused. This is really focused on your cardiovascular fitness. And something with respect to cardiovascular fitness that's important to point out is that in order to benefit the heart and lungs, that 150 minutes can be broken up in any way over the course of the week. So it can be 150 minutes all at once, or it can be 150 minutes divided throughout the week, however you'd like. So you can get 10-minute efforts that count, even maybe even 5 minutes, although that might be a little short. 10 minutes, I'd say, is probably a reasonable lower end to start with, all the way up to 150 to get that really sustained benefit to the cardiovascular system. As we start to push up into that 7 to 8, we're looking at vigorous activity, and that when we get up into that range, it starts to push us out of the aerobic range that we were talking about to the anaerobic range. So anaerobic means, ana means not, and aerobic means oxygen, right? So we're not using oxygen anymore. We're using basically sugar. So usually using mostly glucose to create our energy for our body to move. So with anaerobic strengthening, it means we are pushing our muscles to fatigue. And the way that I look at this a lot, the benefits are at the muscle and really bone level, muscles and bones, to create kind of a fountain of youth for those tissues, because it helps turn over those old tissues. It's more aggressive. It's going to help turn over those tissues, break them down, like I said up here, to create newer, healthy tissues. And if we jump back up real quick to the aerobic section, the heart is a muscle as well. And so the way to work the heart really hard is to get it beating a lot. And that is when we're at this moderate level of activity, and we sustain that for a time. So essentially what we're doing with the aerobic fitness is the same thing. We're breaking that heart muscle down to rebuild a healthier, stronger heart tissue, heart muscle tissue. So that's how we work the heart muscle really hard, through aerobic activity. And anaerobic activity is how we work a lot of the other muscles really hard. So we're using mostly glucose, and again, it's maintaining kind of a fountain of youth. It's turning over those muscles. And it's interesting, some of the studies that have been done on like some of the biopsies of muscle tissue in older populations, individuals that are working out regularly, just doing like your regular cardiovascular training, when compared to individuals that are sedentary, like doing nothing, or individuals that are doing some level of anaerobic training or strength training. Those muscles of the strength training group in these older individuals look younger when we examine them under a microscope. So this really does change the anatomy of your muscle in a positive way. So turning over those tissues. And something that's important to note with these is it has to be a challenge. And that's one thing that that we kind of pride ourselves in here at Alliance is being, helping people learn how to push themselves a little bit more. And that really helps you get better and significantly better than you would otherwise. And we're very aware of making sure it's a safe environment and a safe thing for that individual to do at that time. We work alongside with cardiac rehab here, so we do get a lot of patients with heart issues and things like that. So we have to always be aware of examining the whole body from end to end and understanding what risks there are to challenging people more, and weigh those risks with benefits and the patient's input on it. But understanding that challenging people a little bit more will definitely improve their ability to participate in their daily life. So we do take people and push them up at that 7 to 8 range, probably not 9 or 10 usually. I don't know if maybe Sam does. No, yeah. So it's just kind of like asking them to push a little bit more, to create fatigue, to make sure when they're done with that set of exercises that they are actually feeling fatigue in the muscle and they're feeling tired. And then we ask them to recover and do it again, recover and do it again, in order to get that improvement in the muscle tissue. So those are some things that we definitely want to keep in mind and help people be challenged with. So this is an area where creating a program on your own, if you were to do that, you've got to start small. Like don't take what I'm saying here and immediately go do like a whole upper body workout of exhausting yourself on each repetition. Take your time, build this up, or consult with a professional such as a physical therapist. Obviously, I'm a little biased, or even personal trainers and people like that are equipped to help you with that, as long as you don't have any significant comorbid conditions, like other things going on that could put you at risk. And at the very least, if you do have some other conditions going on, talk to your doctor first, your primary care practitioner first, before really getting into this, especially if you're going to do it with like a personal trainer or someone that just doesn't have as much medical training on the side of things. So that idea of just challenging yourself then comes down and applies well to the neuromuscular side of things. And to call it balance training is a little bit oversimplified. The neuromuscular system is kind of coordination training more so. So that's the system that results in, like somebody can bench press 400 pounds, but they can't like swing a tennis racket to save their life. It's because their anaerobic, their strength system is really good, but their neuromuscular system isn't quite as coordinated. And so that's something that we want to help work on, and you've got to get repetitions in to work on this. And it's something that if you don't use it, you lose it, just like any other one of these areas that we're working. If you don't challenge your muscles and challenge them in a significant way, then if you've ever seen anyone that wore a cast for a long period of time, when their arm comes out of the cast, the muscles on that arm are smaller than the muscles on the other arm. And that's because they haven't challenged or used those muscles for the last 6 to 8 weeks. And it resulted in atrophy. And the body is really smart when it comes to resource allocation. So it's going to take any resource, any tissues that you're not using regularly, and break them down so it can take the energy and nutrients from those tissues and use them elsewhere in the body. And the same idea applies with the balance system. And that's something Sam will talk more about. But if you don't use it, you lose it. And if you're not challenging your balance, then your balance is going to get worse. And there's some complexities to that, but it's something that needs to be worked on and needs to be regularly curated in order to create, in order to maintain safety. And something that is really kind of at the front of a lot of people's minds as they age is that risk of falling, because the evidence definitely supports the idea that if you fall, your risk for a lot of other issues is significantly higher. So that is something that you really want to continue to work on. And again, it doesn't have to be just standing at your counter, standing on one foot with your eyes closed. It can be dancing, it can be yoga, it can be Pilates, it can be a lot of interesting things. It's just a matter of finding that thing that you can really connect with. So maximizing your function, and then preventing catastrophe. So in a lot of ways, I look at this neuromuscular training as the other two systems, anaerobic and aerobic, coming together. You've got good strength enough to make these, to coordinate these complex movements, and your heart and lungs are healthy enough to help you maintain through those complex movements. So those other two trainings kind of come together to help you do the important thing, the really important thing for you, that is like your function throughout your day, and you function through neuromuscular training. So if you struggle with something, say say, for example, something that's really hard for you is as simple as getting in and out of the car, right? Then, like as a physical therapist, the way that we would look at that is, how do we break that up into parts? How do we say, okay, where's the deficit here? Is it in your range of motion in your hips or your back? Is it in your strength and your ability to crouch down to get into the car? Is your car too low? Do you need to sell your sports car? These are things that we kind of break it down into and try to then build you back up from that level. So, okay, say it's really hard for you to squat down. We've got to get your leg strength stronger first. We've got to build your leg strength. And then once your strength is there, we can start working on squatting low, and then eventually squatting low to get into your car. So this is kind of the thought process that we have is when people come to us with functional issues. And that's kind of our bread and butter as physical therapists, being presented with a functional issue and then trying to put together a plan to help you achieve that issue. Oftentimes we kind of are looked at as treating pain, because we do get a lot of people that are in pain, but really the whole idea is to help people recover their functional capacity and do more. So if pain's that thing that's preventing you, then we're going to work on pain. But if it's weakness or range of motion, then we're ready to work on that too. And oftentimes all those things kind of happen at once, and we work on all that. So looking at this RPE scale, the one last thing to mention is that 10 out of 10 exertion is kind of getting up there where it's like something that you could sustain for maybe 10 seconds. So that's a pretty significant level of exertion. And depending on the individual, it may be appropriate to challenge them to that level, and other individuals not. The reality is, the more you push yourself, again, remember, when we exercise and move, we break down tissue. That's the first part of it. So if we over push on some of these things, we break down tissue too much to a point where it's unable to rebuild, basically. And an example of that is something like the fracture of a bone. So we've used too much force on that bone all at once, and it's going to fracture and break. But if we put a little bit of force on that bone and then back it off, and a little bit more force and back it off, and a little bit more force, then that bone slowly over time becomes stronger and more stable actually than it was ever before. And I've done some discussions on osteoporosis in the past, and that's what a lot of the evidence shows. It shows that if we can stress these people's bones in their spine or their hips or their legs slowly in little bits over a period of time, but a significant amount in those little bits of stress, then the bones will actually become stronger. And the same with the muscles. Again, breaking it down to create healthier tissue. But as you start to push yourself more and more, that's where your risk for injury increases a little bit. But it's a situation where it's an increased risk for injury, but it's also an increased reward. So it's a risk-reward ratio that you have to weigh as an individual. And so, the elite athletes are up at this 10 out of 10 oftentimes because they're looking to get the most reward out of their efforts, but their risks of injury become something that can kind of sideline them. And a lot of times at that elite level, part of it is your ability to do the sport and activity, but the other part of it is your durability. So oftentimes so many people aren't durable enough, or they make some mistakes in their training and they end up being sidelined from that. You always hear the guy he was going to be great, right? He was going to be the next, Peyton Manning, and then he ended up tearing his ACL in high school. So it's very real. People have the skills, but they might not have the durability. And the durability is based on how you're pushing yourself, and also based on your ability to recover and recover in between sessions. And then also your coordination in your neuromuscular system. So your ability to move in a coordinated way prevents you from injury. And that, like, to talk about ACL injuries, if we talk about, very common, that's a very common injury, especially in younger female athletes. And a lot of training, like prehab or almost preventative training that's been done, is a lot on coordinating their movements a little bit better to make them a little more athletic in how they're moving. And that usually is found to prevent some of the injuries, depending on how it's done. So moving on to giving you, so I gave you some of the basics behind the idea of exercise. Then I want to give you kind of an outline of how to create a plan to challenge yourself. So we already talked a little bit about this 150 minutes of intensity. And again, all at once versus broken up is fine. You get the same benefits to the cardiovascular system regardless, but orthopedically, it's best to break it up. I mean, orthopedically, if you're opening yourself up, one, for maybe injury, if you're not used to putting 150-minute effort in, and two, we want those tissues, the muscle tissues, to be challenged and then backed off, challenged and then backed off. That back and forth helps things rebuild. Theoretically, that would be a similar idea with the heart muscle, challenge it and then back off. But this 150 minutes all at once versus broken up concept is based on some research that's been done. So it might not really apply quite as much to the heart. I'm not sure of the details of what parameters they were looking at to show that clear cardiovascular benefit. Cardiovascular training considerations. It's a repetitive movement almost always. So it should be a movement that's comfortable, right? So if you have an arthritic knee, you shouldn't do something that irritates that arthritic knee. You shouldn't do something that just hurts every time you do it. So make sure that at least initially, when you're getting into some of these repetitive movements, they're comfortable, something that you kind of enjoy doing, and something that isn't causing you any pain while you're doing it or any significant lingering pain afterwards. And I think as you get into exercise, if you're not used to exercise, you've got to figure out what's a good pain and kind of what's a bad pain, right? Like what's a muscle soreness versus what's something that you need to be worried about, hurting yourself. Muscle soreness that's reasonable is something that should last somewhere around like 12 to 24, maybe pushing it up to 48 hours afterwards. But anything more than that is too much, and you probably push too much and you open yourself up for injuries as a result, versus a sharp searing pain in your knee or your low back. That's something that is a concern, and you've got to make sure that you address that appropriately. But remember, when we're doing these exercises, one of the keys is to create fatigue. You've got to challenge these tissues. If you're not challenging these tissues, then the benefits of the exercise aren't negated. They're not nothing, but it's something that if you're going to put that effort in and put the time in to be at the gym and do it, you should probably try to challenge yourself a little bit. And you can be creative with it. You can change the number of repetitions you do and the number of sets that you do. There's really, if we're looking strictly at like muscle hypertrophy, which is like muscle growth, there's no reason, there's no clear benefit to doing more repetitions versus less repetitions. So sometimes people will say, we need to do like five sets of 5 repetitions of your bench press to get like the biggest, strongest looking chest muscles versus if we do one set of 25 repetitions, that's not going to give you as much benefit in that regard. But that's not true. There's no change in muscle growth with either end of that scheme, high repetitions versus low repetitions. The difference is it might be more in the strength and your ability to gain strength. But it's something that I think you just are creative with, and you realize that there's some days that you can challenge yourself a little bit more and do a heavier weight for less repetitions, or there are other days that you do a lower weight for more repetitions, but still create the fatigue at the end. And a lot of times we settle in on that like range of 3 sets of 10 to 15, and 3 sets is always nice because you build fatigue over the course of those sets. So you challenge yourself in that first set, you're a little tired by the end, but you can recover, give yourself a couple minutes to recover, get back into it. You're a little harder to finish that. And then by the end of the last set, by the end of that third set, the last few repetitions are truly difficult. Like you are really challenged to complete those. And that's a well put together rep and set scheme for an exercise that we're going to try to create some tissue breakdown to rebuild that tissue. Heavy and slow resistance exercise. So when it comes to strength training, for the most part, for what people that are just worried about trying to stay strong and healthy as they get older, the key is really just to be heavy and slow. There's no reason to push it and make it fast. Fast puts extra load on the tissues and opens you up for injury. So nice and slow, controlled repetitions going up and down. Both ways are slow and controlled. That way you can get the most benefit of fatigue in the muscle and get the most benefit of being safe with that movement, making sure that your mechanics are good in that movement. And, initially, especially if you're doing this on your own, pick movements that are safe. So, a lot of gyms have the call it Nautilus equipment or like cable equipment that are machines more so. And while those don't challenge the neuromuscular system very much, because there is one range of movement, right? It just moves straight up and straight down. They do a great job of promoting safe movements if you do them pretty right. There's wrong ways to do it, but they can promote safe movement, and then you can focus on just fatiguing out the muscle group. And again, like I said, we've got to lay down a good foundation of strength and a good foundation of cardiovascular fitness before we can build on the neuromuscular side of things. So if you can't do a bicep curl without swinging your body back and forth or up and down, then do the bicep curl machine at the gym instead and isolate it just to that elbow flexion movement, and try to load up that slowly over time. And then eventually you can transition to trying to bring your strength program together with your neuromuscular fitness program. But in the early stages, it might be better to keep them all separate. And remember here in this, like, something is always better than nothing. So doing something or anything is going to be better than just saying like, well, I don't have the time to do the whole workout today, so I'm just not going to do any of it. That's not the way to go about it. I mean, little exercise snacks throughout the day to just keep you moving, keep your system aware. And in fact, people that are regularly kind of getting up and moving, their metabolism is always kind of functioning at a little bit of a higher level than even someone that exercises, in the morning and then doesn't exercise at all, sits throughout the rest of the day. If you give yourself little movement snacks throughout the day, your metabolism is operating at a higher level. So you're burning more calories, you kind of staying healthier from that perspective of things. So that's another thing to keep in mind with regular movement. Is really healthy for like inflammation in the body. It helps to keep that inflammatory cascade operating instead of just getting stuck and creating more inflammation. It helps kind of heal and move on if you're regularly active throughout the day. One of the keys with all of this, it sounds great, like I'm going to get out and do it tomorrow. But then you have to do it the next day, and then the day after that, and the day after that, right? So trying to develop a routine, and once that routine is developed, you're in pretty good shape. People can maintain a routine relatively well once they're in it. If they fall out of it, it's tough to get back into it. And if they getting into it in the first place is always a little hard. But again, as you exercise more regularly, your body rewards you more for the exercise. So more exercise promotes more exercise. Less exercise promotes less exercise. It kind of stinks that way, but that's the way it is. And so you're going to the first few weeks into exercising, you're going to maybe be like, this is kind of a grind. Like this is something that I don't really want to do at all. But then maybe you're a month in and you missed a day for whatever reason. Then when you miss that day, you're going to realize like you're craving something a little bit. And so the key is not to fill that craving with food, and fill it maybe with some exercise. For whatever reason you weren't able to exercise, maybe break it up into smaller groups or do whatever you can. But that routine is key, and your body is likes that, and it's going to reward you accordingly. And just remember, when it comes to the major muscle groups that we're looking into, you've got your core, your legs, and your arms. And I made sure to write there in an order of importance, your core is the most important. And when you go to the gym, most people are not working their core. It's something that is easily ignored, but you can't, you might have strong arms, but they're not functionally benefiting you unless you move them from a stable, strong core. Because if the arm could be very strong, but if the core gives way, then your system's not going to be able to lift those grocery bags, or it's not going to be able to, if your legs aren't very strong, but you can't, or if your legs are very extremely strong, but your core is weak, then going up and down the stairs is still going to be a challenge. So core is very, very important to work on. And then working on the legs from the perspective of balance and safety are also very important. And the arms are important too, but they fall a little bit lower on that realm of functionally beneficial areas to strengthen. So I would absolutely say we need to work all three of these major muscle areas, but the core is absolutely key to start with. So I think I usually have had this at the end of a lot of the presentations, but within physical therapy, one of the keys is just identifying the weakness and working on them. So we need to know, you need to identify what your limitations are, what your deficits are. If you can't identify them, then talk to somebody that could, somebody that's kind of a trained professional in that area, and help identify them, and then find ways to address them and move them forward. These problems aren't issues with the cardiovascular system and the strength system and the balance system aren't just going to go away with time. It's not one of those things we can just kind of sit and watch. Sometimes pain goes away with time, for sure, but issues in these systems need to be worked on. They need to be curated to improve. So it's not a matter of just kind of wait and see. So that's kind of something that I want to leave you with. Make sure that you know that it takes some work to stay healthy. It really does. But if you have the right motivation and the right reasons to do it, you'll do it, and just find those things that you're passionate about to pursue. And then if you're not sure if they're okay, you can talk to somebody that's a professional to figure it out. So again, I work at Alliance Physical Therapy. We're located in Murraysville and Penn Hills. And remember, you don't need a referral to come to physical therapy. We can always start the care without a referral, and then we can go on from there. We'll contact your doctor, talk to them, and make sure that they're on board, and we can go from there. All right, what questions does everybody have for me?
I haven't seen anything come up in the chat just yet, but if anybody would like to unmute themselves and ask a question, please feel free.
Either bored everybody to death or answered all the questions.
No, I liked it. It was good.
Okay, good. Thank you.
It was a good reminder to me to, get back in the habit of exercising. I mean, I really felt that, because when you're not doing it, you really don't want to do it. So.
Yeah, that's very true. And the body, that's just the way it works, unfortunately. If you don't exercise, it doesn't reward you for exercise. Which is kind of an aha moment for me when I learned that as a physical therapist, because I like exercise. And so, it was always hard for me to relate to patients that hated it, right? But it makes sense. At a physiologic level, the body isn't rewarding them for doing it as much as it rewards me for doing it, because I do it more regularly. So that was always a big moment for me. Do you have anything you want to add, Sam, to all that? You don't have to. Don't feel pressured. I just threw her into the fire.
I don't know that I have too much to add, other than I think most people in the past couple of years have had a change in their activity levels and have probably experienced firsthand what it feels like to do less and then how hard it is to build back up to doing more. So like Colin said, starting with a little bit, and a little bit is better than nothing. So if you're debating between like, oh, I should go to the gym, but I really want to watch this movie, go on like a 5-minute walk and like just get that ball rolling. Because it's the routine building that's going to eventually have your brain give you the rewards that it will with regular exercise.
Yeah, and it, like often getting started is always the hardest part. Then you get out for the walk, and you're like, oh, this is kind of nice. But yeah, thinking about getting out for the walk is always the hard thing. All right, I'm going to stop the recording here.
Hi, can you hear me?
Yes.
I had a question. I couldn't get myself unmuted before.
Okay.
Two questions. Do you have a program for osteoporosis that healthcare would cover?
So it depends in a lot of ways, yes, right? So the key with osteoporosis is that we challenge the body in a way that we're challenging the bones enough to rebuild healthy bones. And that's something that we would need to do an evaluation on you first to identify what your deficits are. And we can roll that into a package of treatments that, depending on your other diagnoses and your other issues, we could work on the osteoporotic issues as well. So it's something that we just have to like look at the person and figure out. And the evaluation is always covered. You know, the evaluation is the process of the physical therapist figuring out one, if you're appropriate for physical therapy and your diagnoses are something that we can work with, and then two, you know, what they should be and how we should operate with it.
Yeah, I've already been diagnosed with osteoporosis. If I talk to my doctor and he said, yeah, let's try that, then I could do something like that.
Yes.
Okay, I'm currently doing Pilates and walking. The other question was, do you use a vibration plate in your practice at all?
We don't have a vibration plate, but yeah, there is some evidence coming out to support the use of those with osteoporosis for sure.
Okay, because I have one.
You have one? Okay, yeah. So we can give you some exercises to work on with that. You know, it's something that I think I've done a talk on osteoporosis in the past, and which it might be on one of the library's websites too, if you want to look at that. But I always, you know, I'm always hesitant about things that seem to be a little bit like too good to be true, like just, you know, standing on a vibration plate and getting benefit from it. But there is actually some pretty good evidence for the vibration plates and improving bone mineral density. So I think it's a very reasonable thing to work into your program that way.
Okay.
And yes, we do have recordings of all of your previous sessions for the Murraysville Library on our YouTube page. Everyone is welcome to go and check those out. Corey, I'm not sure if you also have recordings on one of your pages as well.
Yes, we have them on our YouTube page as well, and there have been ones on both osteoporosis and osteoarthritis.
Yeah, nice. So you could check those out if you'd like.
If you have trouble finding anything, please email me. I can send you a direct link to anyone.
All right. Any other questions?
And I think
right.
we're good.
Sounds good. Well, thanks everyone.
Thank you,
Thank you.
Colin.
Thank you.
Thank you very much.
All right. See you next month.
All right.
Okay.